Hello everyone, welcome to the webinar. It's Eva Servet here and I'm following up on the webinar about the course from last week. Today I will be talking about my story, about how I overcame fibromyalgia in 6 weeks, about how I got to know about Photonic Therapy, and about how Dr. Brian McLaren and his therapy saved my life. And about why I have been torturing hundreds of animals and humans for free in the last 8 years. I'm very excited to share this with you today, as if you are like me, you know what pain and suffering is and you want to get away from it. Or maybe you have a family member or a friend who suffers from fibromyalgia. I am sure I can give you a few tips. So thank you. I'm thrilled that you are here with me today and that you are taking this time and are ready to invest the next 30 minutes in getting to know more about me. Now, before we start, I just want to let you know that I pre-recorded this presentation. Once again, it's because I have a rescue center at my home and one of the animals is not so well, and therefore he would not leave me alone to talk for half an hour without being disturbed. So I prepared this webinar now this afternoon for you in very little pieces, and I'm here live. I was live before and I will be live afterwards and answer any of your questions. So, to start with my past. A long time ago I was a very active young woman. I did most sports kids can do, like basketball and judo and swimming and skiing and running and so on and so on and so on. And that's how I remember my youth, always being busy with something active and doing a lot of sports. And then one day in 1994, things changed. I came home from the tribunal where I had pleaded the case. I was back then still working as a lawyer in Belgium, and I had a motorcycle accident. So I was brought to hospital, but as I did not have anything broken, they let me go the same night. So it all seemed not to be too important. But I went home to, well, my parents came to get me. My father being a doctor, my mother being a nurse. They took me in their home again to keep an eye on me. And it appeared I had several internal bleedings. By the next morning, my whole belly was black. And I stayed there for a few weeks, and then I was supposed to start working again, but it was so difficult. So in the end, what did I feel? I had pain every single day. Once in my arms, then in my legs, then in my hip, then in my knees, then in my shoulders, my neck, anywhere. Okay, and there was no reason why I should have it. I had cognitive and memory problems. I was always tired. I felt really weak. I had no strength anymore and I couldn't sleep well. When it was cold outside, it felt like freezing for me. And if it was warm outside, it was hot. And I couldn't stand loud noises anymore or bright lights. I was stiff in the morning. I had a lot of headaches, intestinal and stomach problems. Couldn't concentrate, muscle spasms, ear noise, and so on and so on. The list is so long. So when did it all start? All these symptoms started in 1994 when I was 27 years old. I was in my second year of practice as a lawyer and I had a motorcycle accident on the Avenue Louise in Brussels in Belgium, and that was it. And that gave all these symptoms. And 6 months later I had to change practice. I had to go to a practice which was smaller and with more quiet, let's say it this way. But even there I just couldn't handle it. I would work in the morning and then during lunch in the afternoon I would be lying on the floor just trying to recuperate. I couldn't sleep, but I was in so much discomfort I just couldn't continue. So in 1995 I put my practice at home. So I would work in the morning, lay on my bed in the afternoon, and at night I would try to prepare my cases for the next day. In 1996, I even moved further away from the noise and the people to a smaller village. And in 1998, I moved into the countryside where I had no neighbors, where there were not a lot of cars passing by. In the end, in 2003, I moved abroad and I landed in this place in the hills behind Alicante with very little neighbors. But my good luck did not stop. In 2005, I had a fall here at the ranch where I hurt one of my knees. And in 2007, it spread in my knees, the disease. Not going to the doctor with one knee, I overcharged that one while the other one was still hurting, and I developed something called chondromalacia rotuliana. I've had several OPs, but it's a degenerative disease, and I would need prosthesis in both knees. And then in 2008, I broke my back in a fall with my horse. After I broke my back, lumbar 4, I did use my insurance. I was still working as a jurist translator here in Spain, being my own boss, and I took leave of work. And while I was at home, my doctor decided to have a checkup because one of my symptoms was also that I would have fever. I would be feverish for months in a row, but my blood results were always perfect. So now I was at home, I didn't have to go to work, and my doctor decided, okay, now we are going to turn you inside out and we are going to find out what is going on with you. So I had a lot of medical exams at that moment. I saw the traumatologist and the neurologist, I saw the rheumatologists, and every possible doctor you can imagine, to finally end up with a rheumatologist specialized in fibromyalgia, and she said, I am going to do the tender points with you. And that tender points test was positive. And the only thing I could say was, fibro? Fibro what? I had never heard of this word, fibromyalgia. I had never heard of this word. So, of course, as soon as I got home, I got on Google to find out what is this disease. And I end up with this book, which talks about the 100 symptoms and syndromes of fibromyalgia. And I was positive on 99. Suddenly, I discovered what I had been suffering from all these years. All these years, I just had been saying, oh, it's from my accident. It's from my motorcycle accident. That's when all the problems started. It's just from the accident. I did not know it was a kind of a disease, let's say this way, or a situation that was known. So the rheumatologist that I saw said, okay, you have to do some reschooling. You have to go to a center. And you will have some meetings over there. So I went there every 2 weeks for an hour or two. And they would teach us, you have to learn to accept this. Okay, this is something you will have for the rest of your life. You have to learn how to live with it. And so we would get, they would teach us how to relax, how to accept what was overcoming us. And meanwhile, they would pump us up with medication. They would give us medication for this and for that, and because of that medication you would get more problems in your stomach, for example, so you had to take other medication for the side effects of the first medication. What did it teach me? The school didn't teach me anything, and the medication didn't help me anything either. The only thing that I had to make a conclusion after a few months is that I will not continue this life. I was not prepared to keep living this life in pain every day, not being able to live my life, not being able to work the way I would like to work, not being able to do what I would like to do, and I was desperate. So a few quick words about fibromyalgia. about the cause, they are still not really sure what can cause fibromyalgia, because there could be a number of factors involved, but mostly it's linked to being exposed to stressful or traumatic events, such as car accidents, or injuries to the body, or illness or infection. Now, in my case, it was totally clear. It was from the motorcycle accident. It's when it started, and it's since then that I had all the symptoms. I've done what the doctors told me to do, and I took medication for some time. But after knowing what I got to know is that nothing was changing, although I was taking all these medications. And meanwhile, I had learned how to relax and how to take it easy and how to try to accept it. But I didn't want this life anymore. It's as simple as this. I just did not want to continue. So one day, I was lying in my bed, and I was on my laptop or on my tab, no, on my laptop, and I was reading on the study forum, and I happened to read about McLaren Photonic Therapy. Now, you must imagine, at that time, I had seen so many doctors, and I had tried so many therapies. Yeah, not only the medication, you do therapies, and you go to this doctor and to that doctor and to this therapist and that therapist. So I had tried everything. So you think you've seen it all, and you just don't believe anymore. So at the time that I read about McLaren Photonic Therapy, I was really asking myself, what is this one of those where they say it will help, but it doesn't? So I was recovering from that fall, and at that same moment I was also waiting to undergo an operation because of carpal tunnel syndrome. And yeah, the fibromyalgia, I already had it for over a decade, so I was not really feeling really good at that moment. Still, as I thought I had nothing to lose, I did a full research on Brian McLaren and McLaren Photonic Therapy. I contacted Dr. Brian McLaren, and I told him all my problems, my health problems, and I asked him what his system could do for me. And he was quite quickly and honestly to answer me that some things were possible and some things would never change. Thing that would never change was the stigma and the wording that they would use, and the illness that you would have in my situation, that I was a sufferer of fibromyalgia. He told me what the treatment would consist in, and as the operation that I needed for my hand, the carpal tunnel syndrome, that would cost me €1,000, although I did not have much money at that time, and the pack of the works was really expensive. I think it was over €800. It was that moment that I said, okay, if this does work, I do not need the operation. So I must take a chance. Even if it's my last chance, I have to do this. So I decided to leap in the unknown, and I ordered a complete set of the works so I could also help horses, the dogs, and the cat. Just as Brian said, after only a few treatments, all the symptoms of carpal tunnel syndrome had disappeared, and I did not need my operation. So I was already really happy, because this, I think this took me 5 or 6 days. So in less than a week, I was already better what the carpal tunnel syndrome is about. And doing the points that Brian was telling me, my chronic pains were becoming acceptable, and I could take less and less medication, and my general immune system was improving more and more as every week went by. So what did I do? Well, I did what Brian McLaren had prescribed, meaning every 2 days I would torch the standard points for humans. Back then it was, like you can see on the pictures, it was a book. And if you would open it, it would show you, here on the title is standard points, and then he would show you the standard points. And on the right, it's, for example, it's the 3 points you have to do for carpal tunnel syndrome. So I had to do these points every 2 days, again and again. But what is it now? Well, this torching of standard points, photonic therapy, is basically the scientific application of light, in this case a red light, to particular areas of the skin of increased electrical conductivity, and this is to produce particular psychological results. Now, why those standard points? In this case, it's like a cocktail. Yeah, it's a specific combination of points, and stimulating specific combination of points on the skin will cause the brain to release particular hormones and other chemicals to relieve pain, increase the immune response, and promote healing. So back to the treatment I had to do that Brian McLaren told me. Every 2 days I would also torch the carpal tunnel syndrome points. And then later on I would look up the points in the book for the knees. I would look up any condition and do those points that I was suffering from. And this is then how you would find them in the book, which it was then later on a USB stick. And now we also send it online. You would just, in the front of the documents, you would look up the disease you have or the problem you're having, be it a eczema or a lower back pain, sciatica pain, or you have diabetes, or whatever your problem is. You would just look up the booklet and do the points that were mentioned in that booklet. So, as you may remember, I just talked to you about the carpal tunnel syndrome. In some cases, you can torch, and a problem will be dealt with within 1 or 2 sessions. And a torch session of the standard points takes me a minute, okay? So it's not long at all. But when you have a chronic situation, like in my case, I had fibromyalgia for over 10 years, or active fibromyalgia for over 10 years, it's a chronic situation. And in that case, you have to repeat your points at least 4 to 6 weeks. Yeah, you do them every 2 days, and it takes about a minute, so it's nothing. So how do you realize then that you're getting better? Well, in my case, I just realized when I would come home that I had forgotten to take my medication that I was supposed to take while I was out. And then I saw that I was having less pain and I was sleeping better. I got more energy. I got more done. And it's like a roller coaster. Taking less medication, you have less side effects. Yeah? Having less side effects, having to take less medication, you have less expenses. And it also goes the other way around. If you have less pain, you get more energy, you can work more hours, and you can make more money. So altogether, my quality of life improved drastically after suffering for so many years. My life totally changed. And then from there, of course, I was so stunned of the results that were achieved, I decided that I had to know everything about this therapy, so I would be able to help other pain sufferers. I contacted Brian again, and I went to do study level 1 and level 2. In the UK it was then, and I took some private tutoring. McLaren Photonic Therapy then became Advanced Photonic Therapy, Brian McLaren and his son Rob McLaren. That started in 2010. And after Rob came to visit me in Spain, I became a qualified photonic practitioner. And all these years, since 2009, I have been teaching workshops in several languages in several countries in Europe and at my home ranch in Spain. And I would do that in my free time because I was still working as a lawyer, no, as a jurist and translator here in Spain. So I would give those workshops during the weekends. Now, it's a fact. I have been torching a lot of animals and peoples over the years, and I have even saved lives sometimes while doing so. For me, the main thing is to take their pain away, as I know personally what pain is, because I have suffered a lot myself for many, many years, not only because of the fibromyalgia, but also because I broke my back and I had other accidents. The main thing, though, is that Photonic Therapy and Brian McLaren saved my life at a moment where I saw no more future for me. All the medication the doctors put you on when you have fibromyalgia and their conclusions that this would be my life for the rest of my life, no, I just couldn't take it. So I have been forever grateful for finding this therapy. So my thank you for my new life has been to torch every single one for free all these years. When I see a living being in pain, I just want to help. Okay? I help because I want to help. It's not for the money. It's for the smile. For the fact that I'm taking the pain away and that living being is going to feel so good afterwards. That's why I'm doing it. Because letting him live without pain is the greatest gift of all. And you see, that's where I differ. I know personally what the torch can do, okay? I did it on myself. I know what it can do. But it will do it if you use it correctly. And thus, also, you have to use it on the points that you have to torch. I experienced this myself, and I have seen the results on many hundreds of living beings. I know what is possible. So, that's it. Photonic therapy heals everything. Photonic therapy is the best there is? No. Well, for me, yes, but not in general. I mean, that's not it. I also did something else. And I took my agenda and I took notes during 14 days. And please, I suggest that you would do this too, because you will get to learn so much about you. And so you take notes for 14 days. You have two sides in your agenda, left and right side. On the left side, you take note of everything you drink and eat during the day. And you just take note of everything. Okay, 9 o'clock, get up. A glass of water or a glass of coffee or a cup of coffee or whatever. What you eat, whatever you put in your mouth, you take note with the hour. And on the right side of your agenda, you write everything that's happening to you, which is not normal, let's say. An example, at 12 o'clock you get a headache, so you write down 12 o'clock, headache. 2 p.m. you go to the toilet and you have diarrhea. So you take note. And so you do that for 14 days. You don't look back. You just, whatever happens to you and whatever you drink or eat, you take note of that. And after 14 days, you go back and you read where things got wrong. And you go and have a look what you had been eating or drinking that day. Now, when they were testing me, before I knew I had fibro, when they were testing me, when they were doing all those tests, they also did allergy test and so on, and lactose test, and I had no problem. I had no problem at all. But taking these notes for 14 days, I discovered that every day that I had taken in the morning milk or yogurt or cheese, every afternoon I would have had a headache. So, okay, I took it to the test. Now, I used to have headaches various days of the week, okay? So I stopped eating milk and yogurt and cheese, and suddenly I had a lot of lesser headaches. Now, I went to the clinic and I had no allergy I was not lactose intolerant. And still, my body showed that my body could just not handle it. So with making this the agenda and seeing what's happening to you, you will find out things that your body just can't deal with. I found it out for white sugar. I found it out for the milk and the yogurt. Does that mean I don't eat it anymore? Yes, I sometimes I still eat cheese at night, because if I eat it during the day, I will have a headache. If I eat it at night, well, my body will have a hard time doing it during the night, but sometimes you just want to be able to take some of it. Okay? So, the other question, only APT works, so APT is Advanced Photonic Therapy? No, that's not the only miracle thing that could work in this case, but it worked for me. And it worked for so many others. I mean, I think the last number, I saw that there were over 20,000 torches sold in the world. Okay, mainly in America, and then Australia, and then the UK. So I mean, it's not just for me. And if you go on Google and you go for red light therapy or photonic therapy, you will find so many. And people who have horses or who are with paralysis, they know everything about it because they probably have saved their horses too. But no, photonic therapy is what saved my life. Thanks to that, I'm still here today. Then there is the diet. I know now, thanks to the agenda, with what kind of food my body has problems. So, and then again, you still have to be moving and be active. But the more you feel healthy, or the healthier you feel yourself, the more you will become active and you will be moving again. Now, probably you're all asking yourself if I am healed of fibromyalgia. No. Once a doctor puts the name fibromyalgia on you, you can't get rid of. Do I feel fine? Yes, I do. Do I still have problems? Yes, I do. Why? Because I'm such an active lady that I trip a lot, I fall a lot, and I hurt myself. So, or I'm cooking for all these animals here and I burn myself. So, no, I'm still using the torch a lot. Now, my program of today is once you have been torching yourself every other day in the beginning, you can go down after a few weeks you go down. If it's a chronic disease, you go down to every 3 days, once a week. And finally, to keep your health system in balance and your immune system strong and the pain levels low, you just torch yourself the standard points every 14 days, and it just takes me a minute. So on the other hand, if you would fall, you would put the torch on you immediately. So imagine it's your ankle, you fell and you hurt your ankle. If you torch immediately, it will not swell up like that. It will not be painful like otherwise. And if you torch immediately, you will be walking home instead of being in pain for 2 weeks and walking with crutches. So my program generally is I do my standard points, and then depending on what happens to me, what symptoms I have. Now imagine I have eaten something bad at lunch and I get stomach problems or intestinal problems, then yeah, I take my torch and I do the specific points for that problem. And no, it's still possible that tomorrow I have a tooth that's aching. Okay, then I take my torch again and I will do the points for my mouth to take the pain away there, and then I'll go and make an appointment with the dentist. So yeah, the torch here is being used every day. If it's not for me, it's for the animals. I have dogs here with severe arthritis. Well, in this case it's arthrosis and deformation of the elbow and so on. And that dog is not taking any medication, no painkillers. We're doing it all with the torch. And I have horses, I have cats. I mean, I have a lot of animals, and most of them, if you save them, they are not healthy. So this helps me to keep the vet bills low. Of course, in the first place, you always have to know what the origin is of the problem. You need to, if you want to deal with something, you need to know the origin. It's the same with a headache. If you have a headache, I have no problem that you use the torch and torch the headache away, the pain away. But if you're having several headaches a week, you have to find out why you're having them. So if you have a problem, a one-off problem, it's no problem to take the torch and use it. But if your problem is coming back, it means you are not dealing with the origin. Because it's the same for me. If I eat cheese, I'm gonna have a headache. I can torch the pain away from the headache. But if tomorrow I'm gonna eat cheese again, I'll have a headache again. Because it's the cheese that's the origin of my pain. It's the cheese that's the origin of my headaches. Okay? So that's about it. This is just a short story about me. Anybody who has any questions can put them in the chat and I'll respond to them. If you want to talk privately to me about your situation, you can find me on Facebook under Photonic Therapy, or you can find me under my own name, Eva Servet, and I'm happy to talk to you. I am here because I know what pain is, and I know how it can ruin your life. So please take care of yourself. If you're not well, go to a doctor, go find out what's going on with you so you can treat the origin, and take care of yourself. Okay? Bye-bye.